Children. Here's where I think we've really fallen down. You know, it's one thing to talk about adult obesity, and it's real. We got to talk about it because the medical care costs are huge. And there are some who would say adult obesity is that's a personal choice. People just don't have the will, and they just can't get it done. I will tell you right now, I think I made it clear, I do not subscribe to that school of thought. I think that just like smoking, people can use a health coach. And we need to figure out, and sometimes some need more than others, and that's okay. But having said that, there is no excuse. There is no way that we can blame children who are obese for being obese. We might blame their parents. We might blame, we still might want to make it out there, and I would say to you, we as a society have failed our children. Our children are substantially more obese today than they were 15, 20 years ago. And when you go 15, 20 years before that, childhood obesity rates were half of what those were. We've tripled childhood obesity rates in this country over the last 3 decades. In Texas, it's about 40% of children are overweight or obese in the state of Texas. In addition, if you are a Latino child or an African American child, you're even more likely to be overweight or obese. Some of that may be because Latinos and African Americans are more likely to live in low-income households, and burgers are more affordable than healthy fruits and vegetables. So again, to blame parents because of the situation they're in is not a fair thing to do. But we can step back and say, what can we do as a society to make that different? Childhood obesity is a real bad deal. Children in Texas are being diagnosed with something that used to be called adult onset diabetes when they're 9, 10, and 11 years old. And the only reason a 9-year-old is diagnosed with type 2 diabetes is because he or she is carrying more weight around than he or she should be carrying around. Now, the good news around that, and I may just jump to some conclusions now because you need to hear this for your legislative agenda, is that there are things that can be done. Coordinated school health programs, those are programs that are in the schools. They promote healthy eating, so the food that's served is healthy. The lunch lady is somebody who is helping you make good choices, not just making sure that you don't tap your friend with your fork. But is actually talking to you about, well, the broccoli is pretty good today because we prepared it with a little bit of cheese on top. So lunch lady could be, a dietitian aide and really provide some information. It's also schools where PE has been put back into the schools. And on that note, here's something you need to know if you didn't know it already. The last legislative session, we decided as a state, at the legislative level, that we needed to take the little requirement that there was for PE or health education in high school out. And that is a big health mistake. In kindergarten, when they enter, in first grade and kindergarten, when they enter, even second and third grade, they're not as healthy as maybe we would like them to be. But it gets worse year after year after year after year. So by the time our young people are graduating from high school, they are not as fit as they were when they were in 4th grade. And that's a problem. Let me tell you why that's a problem. There's evidence out there that says fit kids perform better in schools. Kids who have PE during the day, they pay attention better, they behave better, and they retain better. There's some teachers here. And so that is so important because we have taken physical activity out of schools, believing that if we devote more time to learning, we're going to have our young people passing exams. And the evidence suggests that if you put a little bit of PE back, you can actually teach more and better in less time. And so that's something you all need to be mindful of as you're talking to legislators. Coordinated school health programs. The other thing is integrated curricula. That is, lessons integrated into the curricula that teach teach nutrition messages or lessons. So it might be math problems that are about fruits and vegetables versus donuts and brownies. I don't know. But there are ways to do some teaching. The cost of those programs is on the order of $10 to $20 per child per year. Why am I telling you that? Because sometimes you'll hear a legislator say, "That's too expensive, we can't do that." The cost of medical care, ladies and gentlemen, for that same group of children is about $1,000 a year. Wouldn't it make sense to invest 10 or 20 of those dollars if we had a way to think outside the policy box to support those kind of programs that have demonstrated the ability to reverse childhood obesity in the school setting? Blacks, Latinos, whether they're boys or girls, have higher rates of obesity than white children. And why is that important? That's important because the demographics of our state are changing. The demographics of our state are changing. This is a state where right now 30% of the population is Latino, little less than 50% is white, about 11 to 12% is black. By the year 2050, 50% of the population is going to be Latino. So all things staying the same percentage-wise, and all things staying the same in terms of percentage of children who are Latino, who are overweight or obese, we will have more childhood obesity in our state. And so even as we think about solutions, we do need to think, are there things that we might need to do differently in some communities and in other communities? The idea of doing something about childhood obesity is really, really complicated. So whether we're talking about where we do it, communities, work sites, healthcare, whether we talk about what contributes to obesity, demographic factors, psychosocial factors, gene, environment interactions, or the sectors that can make a difference, it's extremely complicated. And there's good work going on in our country, but this is a slide I've put together that is meant to say, when we look in one community, it can appear that we've got things covered, and we're doing something about childhood obesity in our state and food policy in our state. But when we step back, what we come to realize is that there are splotches where there's stuff going on, but the truth is that as we think about our state or we think about our nation, there is more left to do to actually get the job done, and we will not have a blue barn until we have a more concerted, comprehensive effort. I'm optimistic because we learned some things from tobacco. Comprehensive approaches work best. Single interventions don't work as well. Programs must be sustained. And I want to say here, if you don't already know, Texas now has a Food Policy Council, and that is the kind of coalition that could bring people together to engage in conversation about what makes sense for Texas. The answers for Texas may be very different than the ones for Minnesota or the ones for Pennsylvania, but the fact that there now is a Food Policy Council, I think, is a very good thing.